Phew, that was good, wasn't it? Okay.
Sorry.
Okay, now we will resume our consideration of agenda item 15, progress reports on technical programs document WPR/RC74/9. As usual, if you wish to speak on this item, please click the big button on your microphone. May I call on representative of China to be followed by Hong Kong, China.
OK，谢谢主席。
Thank you, Mr. Chair. Distinguished guests, delegates, ladies and gentlemen, China thanks the Secretariat for the provision of the progress report. We want to comment on 15.2 and 15.3. Chinese government attaches great importance to NCD prevention control, implemented the Health China strategy in a sweeping manner, and improve our NCD prevention control working mechanism, enhance the monitoring system for NCD risk factors, and advance early screening and comprehensive intervention on major NCDs. We always prioritize prevention, integrate prevention and treatment, and have built a full life cycle, whole process service system to cover the whole population with a view to constantly improving people's health. We have also carried out cost-effective control on the risk factors: smoking, alcohol consumption, unhealthy diet, and physical inactivities. We've also prevented cardiovascular diseases, diabetes, chronic respiratory tract diseases, and stage 2 and stage 3 of cancer. These have been proven highly economic and cost-effective. We will follow closely the evidence-based evaluation of NCD prevention control measures, their efficacy, and roll out good practices. Every person should take charge of their own health. We suggest the public service providers give attention to the improvement of guidance for personal health skills, enhance individual health literacy in a bid to better address issues of NCDs. On climate change and health, climate change and environmental hazards have a severe impact on the global public health system, requiring heightened attention and response from WHO and members. We are pleased to see, with the support and coordination of WHO, the Western Pacific region have taken important actions to mitigate and adapt to climate change and enhance environmental health. With remarkable achievements, China has long been committed to improving ecosystem and engaged in global climate governance. We propose the goals of carbon peaking by 2030 and carbon neutrality by 2060 and implemented an array of measures. China's case of drawing eco-protection red line to mitigate and adapt to climate change as one of the 15 global cases was shortlisted by UN as nature-based solution. In 2022, 17 government ministries and agencies jointly issued National Strategy on Climate Change Adaptation 2035, stressing the role of public health measures in climate change adaptation, focusing on heat waves, ultra-low temperatures, and other extreme weather events, advanced health activities for climate change adaptation and results assessment. China is solemnly committed to climate change control goals, UNFCCC, and Paris Agreement. China works on strengthening national capacity in climate change response in legislation, working mechanism, innovative technologies. China stands ready to work together with all countries in sharing experiences and enhancing cooperation to cope with the health challenges from climate change and environmental pollution. Thank you, Chair.
Thank you. Now I call on representative of Hong Kong, China to be followed by the United States of America.
Mr. Chair, distinguished guests, ladies and gentlemen, Hong Kong, China appreciates the great progress that has been made in the region under the leadership of the regional office. For the 4 thematic priorities, while we have done a lot of work under each area, we would like to share with you our experience on item 15.2. Hong Kong, China is one of the cities that has the longest life expectancy at birth. To tackle the burden of NCDs, we have launched a strategic framework for prevention and control of NCDs since 2018. Furthermore, the Hong Kong China has set up the District Health Center to shift the healthcare system to prevention-focused and community-centered. Our government also released a primary healthcare blueprint in December 2022 to set out a series of initiatives for primary healthcare development. Other than the cervical cancer and colorectal cancer screening program, the chronic disease co-care pilot program will be launched later this year to provide subsidies for early diagnosis and management of target chronic disease. Mr. Chair, tobacco use poses serious health threat. Hong Kong, China has been the WHO Collaboration Center for Smoking Cessation and Treatment of Tobacco Dependence since 2012. We have further strengthened our legislation to regulate not only the tobacco product, but also the alternative smoking products since April last year. Together with the other measures in combating tobacco uses, our smoking preference have gradually decreased from 23.3% in 1982 to 9.5% in 2021. To move forward, the government has launched a public consultation in the third quarter of 2023 with an aim to formulate a detailed proposals for the next phase of tobacco control work. We also agree with the regional office that investment in school health for children and adolescents is effective to combat NCDs. Based on the WHO's World Health Promoting Schools concept, our whole school health program effectively promotes physical, mental, and social health at school settings. Together with the adolescent health program at secondary schools and collaborative work with other stakeholders, we'll continue to create a facilitating environment to promote health among children and adolescents. Ladies and gentlemen, moving forward, we will continue to support the WHO's initiatives by taking a proactive approach in prevention and control of NCDs and promote healthy aging. We look forward to work closely with the regional office in sharing our experience with the other countries in this region. Thank you.
Thank you. I now call on the representative of the United States of America to be followed by Cambodia.
Thank you, Honorable Chair. The United States would like to thank the Secretariat for the progress reports and commends WIPRO's efforts to strengthen health security and reaching the unreached in the Western Pacific region. With regards to health security, including antimicrobial resistance, AMR, Agenda Item 15.1, we reiterate our commitment to regional and global health security, including the implementation of efforts to combat AMR. COVID-19 remains a firm reminder of the importance of strengthening public health emergency preparedness and response capacities at the local, regional, and global levels. It is essential that we continue to include lessons learned from COVID-19 into our emergency response plans and investments to enhance improvements in national capacity to prevent, detect, and respond to health security threats before they become public health emergencies of international concern. In addition, we must take into consideration the impact of the climate crisis on global health security as it threatens our food safety systems, outbreaks, and pandemic preparedness, including the spread and emergence of AMR. With this, we thank WIPRO for the support to member states in mitigating disaster risks, strengthening food security, and strengthening capacity to respond to acute public health events. We look forward to a new regional framework on disaster risk reduction and resilience scheduled to be developed in 2024. We recognize the unique threat of AMR is to global health security and acknowledge the report Health and Economics Impacts of AMR in the Western Pacific region 2020 to 2023, published in June of this year, that projects drug-resistant bacterial infections could reach 5.4 million people over the next decade. We saw how the pandemic set back progress in combating AMR and stress that we must continue to strengthen our day-to-day AMR efforts now to ensure this work is not disrupted during future health emergencies. We look forward to continued engagement on AMR at the lead up to the United Nations high-level meeting on AMR in September of 2024. We also recognize the importance of strengthening infection prevention and control, a cornerstone of resilient healthcare system to protect health workers, patients, and the surrounding community from health security threats. We pledge to continue improving regional and global health security, including combating the threat of AMR using a One Health approach by coordinating with relevant sectors in our countries and collaborating with international partners. With regards to progress on reaching the unreached, agenda item 15.4, we are pleased to consider the progress made by member states on empowering community and individual access to primary care. The United States remains committed to strengthening health systems and institutions, advancing global health security, combating HIV, AIDS, malaria, and tuberculosis, advancing sexual and reproductive health rights, and maternal, neonatal, and child health, closing gaps in nutrition, non-communicable diseases, and mental health, and accelerating efforts towards universal health coverage. We commend the collective efforts to strengthening primary care and center health equity as fundamental opportunity to create strong and resilient health systems and communities. Equitable, people-centered, and community-based primary health care brings people into first contact with the health system, and it is most inclusive, effective, equitable, and efficient approach to enhance people's health as well as social well-being and trust. Thank you, Mr. Chairperson.
Thank you. I call on the representative of Cambodia to be followed by New Zealand.
Thank you, Chairs. Honorable Chairs, Excellency, ladies and gentlemen. The Royal Government of Cambodia is profoundly proud of our journey through the COVID-19 pandemic. The unwavering commitment of our whole of government enabled our success, and throughout these journeys, we have identified invaluable lessons on how to proactively stay ahead of the curve. And as a result, Cambodia now manages COVID-19 at a low and stable level, ensuring that the most vulnerable among us continue to have access to health information and services. We are one of a few countries to secure support from the pandemic fund, and this achievement demonstrates our ongoing commitment to cross-sectoral collaboration and on the One Health approach. Together, we submitted a collaborative proposal to fortify our human and animal workforce capacity while enhancing surveillance and laboratory systems for pandemic preparedness. We recognize that only through this approach can we reduce the risk of the future pandemics emerging from zoonotic disease and environmental degradation. For the reaching the unreached, as a country that is rapidly developing, we remain conscious that we must ensure all Cambodians are participants in their own healthcare journey and that those most vulnerable and marginalized are not left behind. Cambodia has a lot to celebrate. Let me just highlight one example of malaria that we made a great achievement so far since 2018. WHO has worked with the Royal Government of Cambodia to implement its malaria intensification plan, including the launch of the last mile activity, which has moved the country closer to the elimination of all species of malaria by 2025. To date, in 2023, only 993 cases of malaria have been reported, of which only 28 were Plasmodium falciparum. It has been 5 years since malaria mortality was last recorded in Cambodia, and achieving our 2020 goals of zero mortality 2 years ahead of schedule. Finally, we want to express our sincere appreciations to our Cambodian health workers for their tireless effort in fighting against communicable and non-communicable diseases, combating AMR, and reaching the unreached. Without their dedication and commitment, Cambodia's goals to create a safer and healthier country for all would not be possible. So also special thanks to our WHO College for your support to us as always as well. Thank you so much, Chair. Thank you.
Thank you. Are there any more representatives who wish to speak on this topic? Oh, New Zealand. May I invite New Zealand? Thank you.
Thank you, Honourable Chair, and tēnā koutou katoa. Aotearoa New Zealand thanks the Western Pacific Regional Office for the progress reports on these technical programs. With regards to item 15.2, we appreciate the WHO's focus on fostering health and social transformation to promote healthy ageing and reduce the burden of NCDs. In Aotearoa New Zealand, we are implementing several related work programs and policies. For example, we have adopted a holistic approach to NCD prevention and management, which recognises the burden of comorbidities, including mental health, intergenerational impacts, and common risk and protective factors. Our recent health and disability reforms have also allowed us to work more collaboratively across government agencies to provide evidence-based solutions to inform health policies and programs. We know that all of government approaches allow for better information sharing, improved policy and programs, and ultimately better health outcomes for our population. Aotearoa New Zealand also appreciates the need to invest early in the health of our children to promote health later in life. Our government agencies are working together through our Tūturu school-based program that sees health services in schools working together to build core health knowledge, values and competencies to prepare young people to navigate life's challenges. Aotearoa New Zealand acknowledges and appreciates WHO's promotion of integrative care for older adults. We are implementing a range of activities to integrate care at the service level, focusing on older people living with frailty and older people requiring rehabilitation after a fall, as well as a range of other social and community support services. Turning now to item 15.3, climate change, and the significant threat it poses to health and health equity in Aotearoa New Zealand, our region and our world. The health impacts of climate change are disproportionately experienced by those who already experience poorer health outcomes. In Aotearoa New Zealand, this includes Māori, Pacific peoples, and disabled communities. Our response to climate change draws on to our Māori, the Māori worldview, in which the interconnectedness between the environment and health is integral. It also emphasises the potential health and equity co-benefits of reducing carbon emissions and building healthy environments. We have continued work as part of the Carbon Neutral Government Programme, under which the health sector is required to measure, reduce and set targets around their carbon emissions and through the development of a Health National Adaptation Plan. We have also recently finalised a climate finance strategy, which guides our delivery of grant-based climate finance to developing countries, in particular in our own Pacific region, including a fourfold increase in available funding compared with the 2019 to 2022 period. Finally, we note the need to further strengthen our systems and technical capacity for monitoring the impacts of climate change and environmental degradation on health. Chair, Aotearoa New Zealand appreciates Wipro's work in these areas, and given the enormity of these issues, strongly supports continued shared efforts. We have a saying in Aotearoa New Zealand, he waka e ka noa, we are all in this together. Ngā mihi nui. Thank you.
Thank you. Are there any more representatives who wish to speak on this topic? If not, I understand that there are representatives of non-state actors who wish to make a statement to the committee on this agenda item. A statement reflects solely the views of the NGOs concerned. It follows that the statements do not necessarily reflect the views of World Health Organization, including its member states. It is my pleasure to call on the representative of International Federation of Medical Students Association and International Pharmaceutical Students Federation to deliver a short constituency statement to the regional committee. You have the floor.
Honorable Chair, Madam Acting RD, and distinguished delegates. Our interventions aims to address the agenda point 15.1 on health security, including COVID-19 and antimicrobial resistance. On behalf of the International Federation of Medical Students Association, IFMSA, and the International Pharmaceutical Students Federation, IPSF, we would like to urge the WHO, member states, and all state actors to critically assess the epidemic control policies, preventive measures, and our strategies of combating antimicrobial resistance. We seek to enhance intergenerational and multilateral collaboration, uniting under the banner of One Health approach. The COVID-19 pandemic served as a crucial lesson for every sector and when addressing health emergencies. The pandemic not only jeopardized people's health, but also negatively impacted the economy and the society. While we commend the regional office and its member states' effort in combating illness and death, we strongly believe the alignment with the independent panel for pandemic preparedness and response, such as strengthening multi-sectoral collaborations, financing pandemic readiness, and establishing pathogen surveillance will be the way forward as strategic preparedness to prevent future pandemics. We acknowledge the grouping infectious disease is a complex endeavor involving numerous factors. As a way ahead, we firmly believe deploying a synergic approach for fostering cross-sector collaboration will be the antidote to uphold the health security of our region. Moreover, we'd like to emphasize the vital role of youth in this network. Young people bear the responsibility for shaping the future of the region. And we have witnessed countless positive change driven by the youth initiative. Students are able to carry out educational and advocacy activities that raise public awareness, in addition to playing a vital role in fostering interprofessional collaboration as mentioned. In the context of antimicrobial resistance, it's important to highlight IFMSA in partnership with IPSF and also the International Veterinary Students Association IVSA and the International Association of Dental Students IADS organized an professional antimicrobial resistant hackathon in November 2022 as part of the WHO's World Antimicrobial Awareness Week 2022 with the theme of presenting antimicrobial resistance together. This event underscores our unified dedication to addressing this pressing global challenge through the One Health approach. We first urge the WHO and its member states to establish an inclusive framework that provides students with early exposure in decision-making process related to health security, drawing from the lessons of COVID-19 and addressing the AMR challenge. We also call on the diverse stakeholders to support on youth-led initiatives, provide training opportunities, and nurture youth's potential as key driver of One Health in the future. We believe in the influential role of students in shaping global health security, and we are committed to contributing to this endeavor. Thank you very much for the kind consideration. Thank you.
Thank you. May I now call the Secretariat to respond to the points that have been made?
Thank you, Chair. I mean, the technical directors will respond one by one to the issues raised if there are any issues in their area. Can we start with our emergency director, Babatunde Olovukur, please?
Thank you very much, DPM. Acting RT and acting DPM. Thank you very much, Member States, for your intervention, and these are well considered. I think we are very appreciative of your support for the work that we are conducting with regards to both COVID-19 and AMR and the overall comments with regards to health security. We note the comment by the delegate from the USA with regards to the disaster risk reduction framework for 2024, and we are currently working on that. Thank you very much.
Thank you very much, Babatunde. Dr. Hiromasha Okayasu, please.
Yes, thank you very much, Acting RD. So I'd like to express our thank you to our member states for very helpful and encouraging input to the discussion on the progress report related to a thematic priority on non-communicable diseases and then aging. And then I particularly appreciated that your encouragement and an understanding that preventing NCD is not just about the some sort of a medical interventions or very specific intervention of tobacco and obesity, but rather I think we need to work on different environmental issues, working with different sectors. And then I'm very much looking forward to continue working with the strengthening implementation and then investment of NCD prevention and then control while proactively preparing for population aging. Thank you very much, Acting RD.
Thank you very much, Hiro. Over to you, Dr. Rajendra Yadav, Acting Director, Disease Control Division Programs, please.
Thank you, Acting RD. We are grateful for all the comments and the excellent work that member states are doing for using innovative approaches for equitable access to primary health care focused activities that are being done to reach the unreached. We have also noted excellent suggestions. For example, Australia suggested that we do more detailed reporting on women, girls, ethnic minorities. So we have taken all suggestions into account and we'll report back to you next time about all them. Thank you.
Thank you very much. And finally, Dr. Kidong Park, please.
Thank you, Dr. Yakab. So we appreciate the country's renewed commitments to continue the UHC journey by strengthening primary health care. And the WHO will provide necessary support to assist your journey. An ongoing actions happening in Wipro is the development of the UHC roadmap implementation guide, which will help country renew their commitment and then redesign UHC journey. We also hear very clearly that there is a great need to strengthen UHC and then SDG progress monitoring framework and then measure country impacts globally at the regional, at the country level. WHO working on this in parallel with the development of the General Program of Work 14, GPW14, as you received the presentation earlier this week. So regional office will focus on country support to strengthen countries' data management capacity. And then also we will generate regional reports to provide information to support data and then evidence-informed decision-making and policy-making at the regional level, at the country level. Thank you, Dr. Yakab.
Thank you very much to technical directors, distinguished representatives. We really appreciate the valuable comments that you made and the commitment expressed toward for the future vision, as well as the acknowledgement and support from the Secretariat. As already expressed by the technical directors, WHO will continue to work with member states to support the development and implementation of policies to tackle health issues and of course also to address environmental challenges. We will keep accelerating the implementation of the For the Future vision in the region, building on the progress to date and taking effective action that will protect and promote the health of the people we serve. Thank you very much for your support, and back to you, Chair.
Thank you, Director and Dr. Yakab. That concludes our consideration of this agenda item. Thank you very much. We now move to agenda item 17, Special Program of Research, Development and Research Training in Human Reproduction. Membership of the Policy and Coordination Committee, document WPR/RC74/11. May I request the Acting Director of Health Systems to introduce the item, Mr. Venal Torres.
Thank you very much, Mr. Chairperson. Mr. Chairperson, distinguished representative, the WHO Special Program of Research, Development and Research Training in Human Reproduction established the Policy and Coordination Committee as its governing body. The committee has a total of 34 members, including 14 members elected by WHO regional committees for 3-year terms. 3 of these are allocated to the Western Pacific region. At present, the 3 member states from our region are Malaysia, Mongolia, and the Kingdom of Tonga. The term of office of Malaysia expires on 31st December 2023. The regional committee is now requested to elect 1 member state to succeed Malaysia and serve a 3-year term starting 1st of January 2024. The regional committee may wish to consider the People's Republics of China as a member of the Policy and Coordination Committee and, as such, to nominate a representative upon WHO formal request to China's Minister of Health to serve on the committee for a 3-year term from 1st of January 2024 to 31st December 2026. Thank you, Mr. Chairperson.
Thank you again, Mr. Torres. Are there any comments? If there are no further comments, I take it that the committee agrees that China should serve as a member of the Policy and Coordination Committee of the Special Program of Research, Development and Research Training in Human Reproduction. It is so decided. No need to buy. Okay. We will now resume our consideration of agenda item 16, document WPR/RC74/10. We will continue our consideration of item 16.7, other items. This will be followed by agenda 16.2, agenda for the 75th sessions of the Regional Committee for the Western Pacific in 2024. For agenda 16.5, items recommended by the World Health Assembly and the Executive Board, member states wishing to comment can submit their inputs either to the focal points indicated in the working document or to the Secretariat. Following yesterday's discussion on 16.7, I understand that the representative from China would like to take the floor. China, you may have the floor.
谢谢主席。中国
Thank you, Mr. Chair. China attaches great importance to the solidarity and cooperation within the Western Pacific region of WHO and cherishes the long tradition of consensus-based decision-making. We are pleased to support this decision, and we support the work of our new regional director in this realm of activities. It's our sincere hope that on the issue of equitable allocation of executive board membership, the new ID and the Secretariat shall continue to play an important role while honoring the long-cherished tradition that has been proven effective. Before the caucus meeting for EB membership discussion, communication and coordination among applying countries shall be stepped up with an utmost effort towards finding a consensus. Again, our congratulations on the nomination of Brunei Darussalam and the Republic of Korea as new EB members. Will always, as always, work with other regional EB members and play an even more active role on behalf of the Western Pacific region to make greater contribution to global health. Thank you.
Thank you, China. Would any other representatives like to take the floor? Japan.
Thank you, Mr. Chair. First, I'm very sorry for my late intervention because I had to communicate with my capital. Japan thanks New Zealand and the Republic of Korea for a proposal. We recognize the necessity of discussion over this matter and that we should find a solution as soon as possible. Japan appreciates various inputs from member states for that in this regard. On the other hand, same as our previous regional meetings, we should go for reaching consensus. It is our culture. In this context, we share concerns with China on the immature decision over this important issue. I'm wondering if there is any way out. We recognize that this is a very important matter for all the member states and that we have been in the current situation after the long discussions at informal sessions. Then, must we discuss this issue immediately? Compared with previous situation on this matter, nothing has changed without an election of new regional director. Therefore, we assume that it is not appropriate timing to discuss this important issue because now is a transitional period. In this context, we would like to propose the following 3 points. The first is we will start the discussion under the new regional director. The second point, historically, this has been discussed informally and we should continue to discuss at informal meetings. And finally, to avoid immediate discussion, we should set open-ended informal meetings. I thank you.
We'll take a few moments to confer with the Secretary. Thank you. Would any other representatives like to take the floor? If none, I'd like to invite Dr. Jakob.
Thank you very much. And first of all, thank you to the member states who made comments on this decision that is on the table. Thanks you to China for consulting back home and to agreeing to join this decision. Thanks to Japan for raising these three issues. And I must say, I agree with all the three issues that you have raised. So with those in mind, I still think it would be a good idea to go for this decision because there is consensus in the room. So if both China and Japan agree, I would suggest that we take forward the decision because basically that simply calls on the new incoming regional director to do consultations with you and to come back for decision next year in the caucus group meeting and if needed in the regional committee. So that's what I would suggest, Chair. Thank you.
I would just like to check if any of the representatives would like to make any comments. If there are no other comments, I take it the regional committee agrees with the draft decision to put forward by New Zealand and the Republic of Korea. As I see no objection, it is so decided. Thank you. Next, we will consider item 16.2, agenda for the 75th session of the Regional Committee for the Western Pacific in 2024. May I call on Dr. Liu Yu, Executive Officer of the Office of the Director, Program Management, to introduce item 16.2. Dr. Yu, you have the floor.
Ms. Chair, distinguished representatives, in continuation of our discussion of item 16, we now consider the agenda for the 75th session of the Regional Committee. This discussion relates to section 2 of the working documents, WPR/RC74/10. For the past 7 years, we have used an approach to development of the Regional Committee agenda, whereby we start the process of identifying main technical agenda items through holding a discussion on possible items at the Regional Committee the year before. This year, we are proposing 5 technical items for the next year's Regional Committee agenda. These items are health financing for social well-being and sustainable development, digital health, One Health, strengthening international legal instruments on health security, which is work of the international negotiating body and working group on HR amendments as agenda items, and operationalizing the global strategy on the environment, climate change, and health in the region in the form of panel discussion. Member states are also invited to share other proposed technical items in consideration for next year. The Regional Committee agenda typically can accommodate up to 5 technical items. These are in addition to progress reports, as well as budget and management agenda items such as this one. With input from today's discussion, the Secretariat will prepare a draft provisional agenda. In January, the Secretariat will informally discuss this draft with the regional's executive board members. We will then send the draft provisional agenda to all member states for comments during the first quarter of 2024.
Thank you, Mr. Chair. Thank you.
Thank you. We will now hear from representatives who wish to speak on this item. Please indicate your wish to speak by clicking the big button on your microphone. Must be the Friday feeling. Okay, thank you. So thank you, Dr. Yu. Now I've lost my scripts. No, this one. If there are no further comments, committee notes the comments. Thank you. We now move to agenda item 18, time and place of the 75th and 67th session of the Regional Committee. May I now call on the Acting Regional Director to say a few words regarding the venue and dates for the next two sessions of the Regional Committee. Dr. Jakob, please.
Thank you very much, Chair, distinguished representatives. Next year, we will convene the 75th session of the Regional Committee. As you may recall, previously China had graciously offered to host the 73rd session of the Regional Committee in 2022. But due to various reasons, this was postponed and the meeting was held here in Manila, the Philippines. And then, of course, this year, we held the 74th session here at the regional office, given our usual practice in election years. We are currently in discussion with China regarding their potential hosting of the 75th session next year. However, we need some more time to confirm this with the authorities. If China is unable to host next year, our convention is that we will hold the session here in Manila, Philippines, at the regional office. We would like to propose to hold this from the 21st to the 25th of October 2025. Regarding the 76th session to be held in 2025, if the 75th session is held outside of the regional office, then it will return here the following year. As such, we would like to propose that the 76th session be held here in Manila, Philippines, between the 20th and 24th of October 2025. We also welcome further expressions of interest from member states to host the 76th session in 2025 in case the 75th session is held here in Manila next year. If the honorable delegates agree, I propose to confirm the details as soon as possible after this session of the Regional Committee concludes and inform member states via a note verbal. Thank you very much, Chair.
Thank you. Do representatives agree on Dr. Jakob's proposal? If there are no further comments, I take it the committee agrees. Thank you very much. We now come to the closure of the session. I understand the Secretariat has prepared a video recapping our meeting this week. Let's have a look. Please play the video.
gentlemen, I have great pleasure in declaring the 74th session of the World Health Organization Regional Committee for the Western Pacific open.
Ladies and gentlemen, we have an exciting and busy week ahead of us.
Welcome to the 74th session of the Regional Committee for the Western Pacific. We are delighted to welcome you back in Manila this year and to host this session on the premises of the regional office. This year marks 75 years since the founding of the organization.
Good morning, and it's an honor to be with you. As you know, this is a particularly important moment for the region as member states prepare to elect a new regional director. Thank you all once again for your continued commitment to promoting, providing, protecting, powering, and performing for health in the Western Pacific. I wish you all a very productive and successful regional conference.
Please stand with me to welcome the regional director nominee that we have just elected, Dr. Saya Mo Yutala.
I am excited and look forward to serving you all as your next regional director. And I have no doubts that together we can continue to show Dr. Tedros that indeed the Western Pacific region and office are indeed a very special region. I thank you all.
Understand that the representative from Tuvalu would like to say something.
Mr. Chairman, thank you for the opportunity. I would like to read out resolutions of appreciations. It's as follows. The Regional Committee express its appreciations and thanks to 1, the chairpersons, the vice chairpersons, and the rapporteur elected by the committee. 2nd, the representatives of the intergovernmentals and the non-governmental organizations for their oral and written statements. Thirdly, the WHO Western Pacific Regional Secretariats for its work and preparing for the sessions and the meeting arrangements. Thank you, Mr. Chairman.
Thank you very much. Are there any comments from the honorable delegates' proposal? Thank you very much. I take it that the resolution is adopted by the committee. Thank you. Now, before we conclude, I understand from the Secretariat that a draft report of this session will be sent to each representative who has been present with a request for comments. If no comments are received by the due date, the draft report will be considered to have been accepted. May I now call on the Acting Regional Director to say a few words. Dr. Yak.
Mr. Chair, honorable ministers, distinguished representatives. The Regional Committee meeting has indeed been a very special one this year. Of course, the highlight was the nomination of the next regional director. Once again, Dr. Piukala, my sincerest congratulations. I am extremely confident that the region will be in good hands under your leadership. And as I said on Tuesday, I look forward to working closely with you in the days ahead to help in your preparations to lead this great region and its incredible staff. The Regional Committee was also a special one this year as we celebrated our 75th anniversary as an organization and the public health milestones that we have achieved together. Gathering in person at the home of our regional office has also been a special treat. So too was our dinner on Tuesday evening, where the Wepro family spirit was on full display. I am deeply honored to have been so warmly welcomed into this Wepro family since my arrival as officer in charge a year and a bit ago. While I am indeed looking forward to the next steps, saying goodbye to this remarkable region will not be easy. This week, we also had many important items on the agenda to discuss. Ministers, it was great to see so many ministers and esteemed delegates gathered and involved in these discussions. Your commitment, guidance, and clear decision-making is instrumental in propelling our work forward. While we have significant work ahead, your dedication to realizing the For the Future vision is very motivating. In the face of increasingly complex public health threats, we will rely on your ongoing support. Threats caused by multiple types of hazards, including infectious and zoonotic diseases, antimicrobial resistance, natural hazards such as typhoons and earthquakes, food safety, incidents, and technological hazards means that we must strengthen capacities and build the systems needed to detect, report, and respond to public health emergencies. The scaling up of evidence-informed, evaluation-driven, and outcome-focused communication principles and practices in line with the C4H approach will help to change minds, attitudes, and behaviors for better health outcomes. And as we strive to tackle persistent public health challenges through innovation, your fresh ideas, collaboration, and determination will be essential. Lastly, we will also need your action to build and sustain motivated and competent health workforces consisting of the right numbers of people in the right places with the right mix of skills. Outside of these main technical items on the agenda this week, I hope there were also takeaways from our panel discussion on health financing and side events on transformation of the regional office and climate resilient and low carbon health systems. I'd like to thank all speakers who joined us and the many colleagues working behind the scenes to make our proceedings possible. I would also like to thank our excellent office bearers this year. Chairperson, Honorable Dato Dr. Muhammad Esham Jafar, Minister of Health for Brunei Darussalam. Vice Chairperson, Sof Stokes Delger, Acting State Secretary and Director of Department of Monitoring, Evaluation and Internal Audit, Ministry of Health of Mongolia. Dr. Saki Nakamura of Japan as English Rapporteur, and Mrs. Francesca Fuentes and Mrs. Ines Ferrer of France, our French rapporteurs. We have prepared some small gifts as tokens of our appreciation, which we will hand out now. First, to Honorable Minister Jafar, thank you very much for your role as a chairperson. Yeah, it's coming back. Next, could I please request Dr. Tox Delger to please accept our gift. And then finally to Mrs. Ines Ferrer, could you please come forward? Thank you very much. Thank you very much. And then Dr. Nakamura, please, could you please come forward? Thank you. Distinguished representatives, thank you once again for your participation and support during this regional committee meeting. I first joined the WHO family more than 30 years ago, maybe the oldest one in WHO, and I have participated in many, many regional committee meetings over the years. However, this one has been a real highlight and it has been very, very special. The commitment and the spirit of this region has left an incredible mark. Thank you for that. Thank you again. Thank you again for your warm welcome into the WEPRO family and for your support of my leadership. Serving you, dear member states, has been a greatest honor and privilege for me. For those of you who are traveling, I wish you a safe journey back. And thank you again and see you next time. Goodbye.
On behalf of the member states, I would like to thank Dr. Jacob again and the Secretariat for their dedication and hard work for this session of the Regional Committee. If there are no further comments, I now declare the 74th session of WHO Regional Committee for the Western Pacific closed. Thank you very much.